A new study finds that hospital mistakes are more common and less reported than anyone ever suspected. The research concludes that about 1 in every 3 people will encounter some kind of mistake while in a hospital, and that current detection methods miss 90% of those errors. Medical correspondent Dr. Jennifer Ashton is here with advice on staying safe in the hospital. Great to have you with us, Jen, but this is a very troubling study.
Absolutely. We have to remember most people go to the hospital to get well, and the fact of the matter is that medical errors in a hospital setting could wind up killing you. So this is a problem that costs our healthcare system about $17 billion a year. A couple of theories behind it. Number one, patients going into the hospital today probably are sicker than they were in the past. Sicker patients, more prone to complications. There are many people involved in the care of these patients from when they hit the door. More people involved, more risk of human error. And lastly, our methods for reporting and tracking these errors have gotten much more sensitive. So when you look more closely for something, you're going to find more of it.
So we are seeing it because we have the ability to find it better. Medication errors are one of the big errors that this study found.
Right.
Why those, and what do you need to do to prevent them?
It's estimated that there are 1.5 million medication errors in this country every year. The reasons for that, there are a lot of medication names that sound similar. That can increase the risk. There can be dosing errors. We've heard before in the news people given lethal doses of medications. This has almost happened to me in the hospital. If it can happen to a doctor, it truly can happen to anyone. And lastly, there can be allergy mistakes. The reason doctors and nurses will ask so many times what your allergy are is to try and foolproof this type of mistake.
You're a surgeon and you operate on people all the time, and we saw this story earlier in the year, this LA hospital which put a transplant into the wrong person. Right. Why does that type of thing happen?
This is probably one of the most dreaded mistakes that can go on in the hospital for obvious reasons, and there are a couple of things that we do when we're bringing a patient to the operating room. The first thing is if you're having surgery on a body part where you have another one of them, like a knee, a kidney, a wrist, the surgeon has to initial with a pen your skin before you go to the operating room. That's one thing. Once we bring a patient into the operating room, we do what's called a timeout, which is very similar to a pre-flight checklist that a pilot will do. Everything stops in the operating room. The circulating nurse has to identify that you have the right patient, the right surgeon who's having the right operation. And lastly, as a patient, you should say, just want to confirm this is the surgery I'm having. You can't be too safe.
Yeah, you talk about a number of things that patients can do, and also the fact you bring up that there are so many different doctors and people who come in and out of that room where you're waiting. Give us our best tips for what people need to do, patients and their families, when they're in a hospital.
Well, the first thing is if you go to a big academic medical center, there will be residents involved in your care. These are real doctors, but they're on a hierarchy system, so they are reporting to a chief doctor under your care. Get everyone's name, find out what level they are. The other thing is when you go to a hospital, it's a good idea to bring a printed copy of your own medical history with all your allergies, all your medical problems. Don't be afraid to ask questions. You're not going to insult or offend anyone. And lastly, always reconfirm the medication, the treatment that you're having. You can't be too safe. Your life is at stake.
Well, thanks so much for being here, Dr. Jennifer Ashton. Always a pleasure to have you, and great information.